Good morning, guys. We're here this morning with Dr. Ryan Woods, a fellowship-trained sports medicine physician at Aurora BayCare. And Dr. Woods, today we're talking about a brand new skill set that you actually bring to the team called orthopedic biologics. Can you help us understand a little bit more about what that is?
Yeah, absolutely. So orthopedic biologics, what some people will coin regenerative medicine, is an exciting new area of medicine where we attempt to harness the body's natural healing ability to promote or enhance tissue repair or healing for patients with common chronic or acute orthopedic conditions.
What about PRP and conditions you may treat with that? Can you explain that?
Absolutely. So PRP stands for platelet-rich plasma. It's one of the orthopedic biologic treatments that we do offer. And PRP basically attempts to harness the power of the platelets. So the platelets are a part of your blood that contain a variety of growth factors and chemical signals that are used to control inflammation and jumpstart or initiate healing response. And so what we do is we can draw a patient's blood, isolate these platelets, concentrate them to very high numbers, and put them back into areas of injury to promote healing, control inflammation, and improve pain and function. And so a variety of conditions that we can use to treat these include things like arthritis, knee arthritis, for example, rotator cuff tendon injuries, ligament injuries, muscle injuries, etc.
It sounds almost like stem cell therapy.
Yeah.
Can you tell us about that?
Yeah, so that's another orthopedic biologic that we do offer here. And again, it's the same idea that we're trying to use the body's natural properties, in this case, cells, stem cells, to promote healing and improve pain and function. And so we're excited about this. This is a very new area of medicine. And so what we can do is harness, isolate, and harvest these stem cells, which have the ability to differentiate into many different tissues. So things like cartilage, and tendon, and bone, and ligament, things that we're really excited about and interested in the orthopedic world. And so, just like the platelets, we can isolate these cells, place them back into areas that are injured, again, whether acute or chronic injuries, to promote that overall healing environment. And there are a variety of ways that we can harvest these stem cells, but that is the idea behind them, is that these cells have the ability to not only differentiate into a potential target tissue, but also, again, release chemical signals and growth factors to promote a healing environment.
It's exciting stuff.
Yeah, it is.
At what point are patients typically good candidates for one of these procedures?
Yeah, great question. And so we do offer these procedures for a variety of conditions, for a variety of ages. Usually we reserve these treatments for patients who have maybe failed traditional conservative management, things like rest, over-the-counter pain medications, splinting, bracing, cortisone injections, physical therapy, etc. So this does give patients another option between the conservative managements and potentially a surgical intervention. So it is an exciting new area. We're excited to bring that, and it's exciting for all of us. So there are conditions that we tend to treat more often than others, and there's certain contraindications potentially that may make patients not candidates for these procedures. So those are all the things we talk about during the visit in order to provide you with the best treatment for either condition.
Dr. Woods, thank you so much for being with us here this morning. If you'd like to find out more about